Hello, I'm Dr. Barrett. This video is for my patients only. If you've had surgery by another doctor, this video is not for you and my feelings are hurt. So make sure you follow up with your doctor for those individual instructions. Congratulations, you have either just undergone a breast lift surgery by me or about to get a breast lift surgery, and this video is designed to give you everything you need to know so that you're prepared for when you're done having your surgery. So take notes and let's get started. So if you had a breast lift with an implant, your recovery might be a little bit slower. If you haven't had an implant, your recovery is going to be a little bit faster. A lot of the limitations end at 2 weeks because we didn't have to do anything to the muscle. So that includes heavy lifting. But if you did have an implant, you want to make sure you don't do any heavy lifting for 6 weeks. Your incisions are going to be covered with silicone strips. They may leak a little bit around the edges, and that's okay. You can actually take a gauze and blot them dry, and you can even remove them and clean the area underneath and reapply them. They are washable and they can be reused. Ideally, we're going to use silicone adhesive strips on the breast incisions for a total of 6 months, so you might need to purchase an extra pair of them if needed. When you wake up, you might have a tightness or stretching sensation in the breast. This is normal. It's okay to take some pain medication. Ideally, we take CBD, magnesium first, followed by Tylenol, and then as a last resort, the Norcos, or the narcotic pain medication. We put a lot of pain medication inside the breast, so don't take any pain medication unless you're having pain. Narcotic pain medication causes nausea, constipation, and can delay your healing, so use them as a last resort. You can also use a CBD balm to place in the areas around the incision to help reduce inflammation and pain. Most likely you're not in a surgical bra. If you are in a surgical bra, it's because we wanted to support the surgery for some reason. Do keep it on until I see you in the office or for taking a shower. But if you don't have a surgical bra, you can wear a loose-fitting sports bra or a t-shirt. Really, you don't have to wear anything. The main reason we do this is so we don't cut off circulation to the nipple. Nipple appearance is very important after a breast lift. We always worry about nipple necrosis. We want to make sure that they are warm and they're not turning medications. The Zofran that you have in there, that is for nausea. You take one of those and you put it underneath your tongue. That helps with nausea pretty quickly. Otherwise, don't take it. Colace, take 1 pill twice a day until you have a bowel movement. That helps prevent constipation. You have antibiotics. Make sure you do take those antibiotics as soon as you get home. You take 1 every 6 hours if it's Keflex. You take 1 every 3 hours if it's clindamycin. Make sure you finish all the antibiotics and don't stop. It is normal to have a little bit of bleeding on your incision for the first 24 hours. It will eventually stop. You can always put a little bit of gauze and some pressure there temporarily to slow it down. Be sure you have your implant card. Take a picture of it with your phone right now so you'll always know what size implants you have. That card has a lot of important information for warranty information, okay? So you can check it out. If you have Mentor, you can actually register for an additional warranty, and Sientra has some other enhanced things that you can check out on the website as well. For the first 3 days, you want to sleep with a little bit of elevation. That could be about 30 degrees, a few extra pillows. Over the next 3 days, then you can slowly start to go back down to flat. Ideally, you don't sleep on your sides until at least 7 days, and you don't sleep on your stomach until at least 2 weeks. So a few days out, don't panic. Your breasts tend to look very swollen and sometimes asymmetrical. Breasts are always slightly different. They're sisters, they're not twins. But sometimes when you're healing, the differences can be even more exaggerated. Don't panic. It's something we can discuss at your post-operative appointment. If one side is dramatically larger than the other and it's very painful, that could be a sign of a hematoma, and that's something we want to know about. We use a lot of absorbable sutures and removable sutures for your incisions. We close in 5 layers. The first 2 layers come out at week 1 and week 2 appointments. The remaining layers are absorbed, and sometimes they kind of spit to the surface. And if that happens, you'll feel what's like a little fishing wire substance on the outside of your incision. If that happens, it's not a big deal. We can trim that for you, or you can take some beauty scissors and trim with a little small pair of scissors to put it down flush underneath the skin so it can heal properly. If you have an area that opens up, which sometimes happens with breast incisions, don't worry. Put a little antibiotic ointment in that area and cover with gauze or Band-Aid. Do that twice a day. To speed your healing and improve your scarring and reduce pain, we recommend to use red light therapy. This could be done with one of our panels or handheld devices from LightStim. You can shower 24 hours after your operation. Just let the water trickle over everything. Try not to get them too wet, and definitely don't do any hot tub, bathtub, swimming, or jacuzzi for 6 weeks. After surgery, your nipples might feel a little bit numb. Don't worry, a lot of times this comes back and it's just a temporary feeling. It can take up to 6 months for nipple sensitivity to return. So activity after the operation, you want to make sure you walk around right away. At 2 weeks, you can start to do exercise. That's generally just legs. And if you didn't have an implant, that can also include the arms, a light amount. At 4 weeks, you can do a little bit of jogging, light jogging. At 6 weeks, you can return to upper body, full heavy lifting and everything else, but using your body as a guide. Don't do something if it hurts. You have to trust your own body's sensations. I don't recommend implant massage until about 6 weeks. I have a specific video on that. Generally, I like to tell you exactly how to massage at the 6-week mark, but basically you want to massage generally from the side over towards the other shoulder. We do have a specific video on that if you're interested. Here is the ultimate supplement that you will need after your surgery to help you heal. I used to use different types of multivitamins to provide for my patients, and then I figured out that there's some things that I couldn't find in commercially available products, so I went ahead and designed my own. Okay, so there's before and then there's after. Before, you want to take 15 days prior to your surgery. A lot of times after surgery, your stomach can't really absorb things very well, so you want to start ahead of time. You can take these on an empty stomach or with food, it doesn't really matter. You want to start the day of your procedure, so don't wait until the next day, start right away, before and after. Makes sense. And then our Arnica Plus, which helps decrease the swelling and bruising. You take 2 of those starting the day after your surgery every single day. CALMg, this is my magnesium supplement. It has 7 different types of magnesium in it. That is very important for absorption. Most of the magnesiums you'll find on the internet, very few of them have more than 1 type of magnesium, and they're most commonly the magnesium that doesn't get absorbed. So you need magnesium that gets absorbed into your body, which this does, and helps relax muscles, it helps you sleep at night, it helps reduce pain, believe it or not. Most of us are magnesium deficient, and this solves that problem. Take 2 right after your surgery and 2 right before you go to bed, and 2 every day since then. I take this supplement every single day. This is something you can take even if you haven't had surgery, but it definitely helps after surgery with pain, muscle spasms, and helping you get to sleep. CALMg. There's also CBD tincture. You can take this at night, it helps you sleep, but it also helps the pain. Take up to 4 full droppers of those underneath your tongue every day if you need to. This is MassZymes. It's made by Bioptimizers. It is a fantastic vegetarian formula that has multiple enzymes that help you break down the food that you're eating and decrease inflammation in your body. Okay, why is this important? Well, your body goes through a very stressful event with surgery. This helps decrease the stress and inflammation in your body, and it's been shown that some of these enzymes actually break down and go into the bloodstream and help you heal faster, okay? But at the very least, it's great to help you absorb nutrients prior to surgery and after surgery, and to be honest with you, I take these every single day. I take 4 of these with every meal, and that's what I recommend for my patients 2 weeks prior to surgery and for 6 weeks after. Use the whole bottle. It will benefit your healing greatly, and it also gets rid of a lot of bloating and a lot of GI issues. A lot of my patients come back and they get this just for those reasons alone. I recommend fish oil after surgery. The fish oil I recommend is Living Fuel Super Essentials Omegas, okay? This has a really good concentration 1-to-1 of EPA to DHA. A lot of the fish oil that's out there, especially if it's cheap, is crap. I don't recommend it. This is the one that I found has the best amount of inflammatory improvement. So to help you recover after your surgery, I put together the essentials of all the supplies that you would need and then some. This makes a great first aid kit, even if you don't use everything that's in here, but chances are you might need something that's in here, and I put it all together for you. Everything from earplugs, ice packs, to gloves, gauze, stuff that you would need after a surgery, stuff that I would want, high quality stuff that we can get at a wholesale price, and we're able to put this in here for you so that you don't have to run to the store to get all these individual things to help you recover after your surgery. Barrett Recovery Kit. If you have the following, please give us a call. If you have dramatic pain on one side of the chest versus the other, or pain that's just not controlled in general, if you have swelling that's dramatic, a little bit of swelling is normal, but especially if it's one side versus the other. If you have redness that spreads out from your incision or any foul smelling odor from your incision, if you get a fever that's greater than 100.3, if you get nausea, vomiting, and you're not able to eat or drink anything, or you get dizzy, lightheaded, and you pass out. Here are some examples of things you shouldn't do after surgery that I've had patients come back with a hematoma. I've had a person open a door that pulled like this and caused herself a hematoma. I've had another patient lift a gas pump. This is all within the first 6 weeks. Lift gas to pump gas, and that happened. Lifting an overhead bag into the overhead compartment caused a hematoma on one patient one particular time. I had one patient open an Amazon box and caused bleeding on one side. Those are some examples of some common things you might not think of that could be problematic for your healing. So really take it easy, have other people cater to you during this time period. If you have a little one, make sure you get a tush baby so that you can hold the little one on your hip without having to use your arms. So congratulations, you've done it. You're on your way to your healing journey and for your fabulous result. Do know that breasts take a while to settle down and to heal. It's a 6-week process at least for them to start looking good. And sometimes they do look different than the other. Don't panic, it's something we could talk about in your appointment, but it does happen to many patients and it's nothing to be concerned about. Congratulations again. If you have any additional questions about your procedure, about your results, please feel free to reach out and let us know. Thanks for watching and congratulations.